Good morning. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today, I'm going to talk about the dentistry that you need today and what is causing the breakdown that you are having in your oral health and your teeth. Now, some of the things that you need done now are a result of things that were done when you were younger or weren't done when you were younger. So things that might have gotten missed that, in your younger years, and now they are showing up because of wear and tear, because of things that weren't done to correct and prevent. And then the other category is, work that was done that has led to further procedures now. So as an adult, you go into the dental office and you have, a list is made for you of all the things that need to be done, which everybody dreads. I mean, part of fear of going to the dentist is the list and, whether it's covered or not covered and all that kind of stuff. There are a lot of reasons for trauma. Some of them are financial and some of them are fear of the sound of drilling or just the whole idea of a needle, etc. So the things that dentistry in the mainstream, what they do and what they don't do routinely, can over time lead to very specific kinds of problems. I'll just give you a quick for instance, and then I'll go into some history and background. So a quick example would be orthodontics that was done by removing 4 teeth and then retracting and contracting the arches. Now, some of the, it may look nice from the front, and that is usually the top goal, is how do the teeth look from the front. But they're not looking at your profile, they're not looking at your lip support, and they're not looking at your jaw alignment or your muscle balance. All of those things that aren't, or tongue space, that's a huge one because apnea and airway resistance and snoring are really epidemic at this point, I would say. And inadequate tongue space, I know the mainstream does not agree with this. Maybe some people that are mainstream think this idea has merit, but the official stance of mainstream self-proclaimed setters of standards of care don't agree that insufficient tongue space could possibly cause your tongue to sit further back toward your throat than would be ideal for your airway. Now, that is, all of those things that get overlooked, missed, or not looked for during the first orthodontic treatment that you have, though even if they didn't take out teeth, they still may have missed the jaw alignment and muscle balance issue, neck posture issue, and kind of moved your teeth to where you're sort of locked into a particular posture with all of those structures. And that, in some people, can lead to problems 10, 20, and 30 years later. Specific kinds of problems, like damage to the teeth from clenching or damage to the teeth from just normal chewing wear and tear that should have been normal but is actually excessive because tooth position is not aligned with how your muscles function best during chewing, and the teeth aren't in a harmonious position. So there are a lot of reasons why people break cusps off of teeth. One of them is filling, the kind of fillings that were put in the teeth, like the big mercury fillings, which expand and contract at a different rate than normal tooth structure, so they create little micro fractures down below, and then you bite on something chewy, not even necessarily a foreign object in your food, although that'll almost always cause a problem if you hit it hard enough. But, there are weak areas of some of your teeth as a result of the kind of fillings that were done. And then you add to that the position of the teeth and the pattern of chewing that may not be, or that the teeth are worn down, and so parts of the teeth that were never meant to be in complete function during chewing are now touching and part of the grinding process. And that part of your tooth is only in contact because the other parts have been worn down through clenching, grinding, or whatever other things have happened. Maybe a dentist got in there and adjusted your bite, and now everything is a little lower, and which can be a good thing, or it can be something that throws off muscle balance and joint alignment. And you may not see the signs of that wear and tear or feel any symptoms of that wear and tear for many, many years following that event. So one of the things that I do as a holistic practitioner is I try to look at the big picture and tie all of these events together to understand what's happening in the present. Now, all of that takes time and diagnostic skill and knowledge. A lot of education goes into being able to understand all of the pieces of the puzzle. And, that takes time, and it takes time in the office as well to look at all of those things and understand what's happening and what the trajectory is. The easy way out is to look in, see a tooth that's cracked, say what's needed to fix the cracked tooth, end of analysis. That's easy, that's quick, time is money. Then you get the person, you do it right on the spot, or you get them right back in to do that crown or onlay or whatever you're going to do. And that's the quick, easy dentistry is just basically a repair person. You look in the mouth, see what's broken, propose what you're going to do to fix everything, make a list, and then the person comes back and you check off items on the list as you fix them. And then the person's good to go. But, people who are more holistically minded tend to want to understand the problem so as to prevent its recurrence or its, happening again on another tooth, that kind of thing. And some of the things that are from the past can be corrected to prevent cracks, wear, breakdown, pain, infection, etc. But if you don't look at the bigger picture and understand how all the pieces fit together, you may not know, it may not occur to you as a dentist to know what to do to prevent. Now, that prevention, those prevention processes that can be done, because there are no symptoms yet or breakdown yet, a lot of times people will nod and say, yes, that makes sense, but I have car payments and other things I have to deal with, and so I am not going to do that yet. And that's fine. But just knowing what could be down the road and kind of having it on your back burner so that you understand how you could, perhaps there's something that can be done that could prevent future breakdown by correcting something that was either done in a way that didn't prevent or that was missed or overlooked. And, a lot of times people who are preventive and holistic minded will want to do procedures and processes that, because it doesn't always include drilling on teeth to do these preventions. Sometimes it's just going in and aligning the joints of the jaw to prevent future problems in the jaw joints, that kind of thing. And the only time that we say that you need to do that is if you actually have pain in your jaw joint or associated structures. But even then, the mainstream does not agree with treating this because they this is kind of an interesting thing, but for all of the things that are preventive that most dentists don't know about, the mainstream has alternative ways to manage these things so that dentists don't actually have to go and learn how to align joints or balance muscles or any of that stuff. And unfortunately, it includes things like tranquilizers and antidepressants and psychological profile and therapy, because the assumption is that your jaw hurts because you're under stress. And they consider it a self-limiting condition because it's usually women, and it's usually during a certain part of life, like middle age, 30s, 40s, 50s. And by the time you're late 50s or 60s, the condition is no longer painful. You may not be able to open very wide, and you may have popping and clicking, but you're no longer in pain. And so they consider it to be a self-limiting, self-correcting condition. But, you know, that I don't think that makes, the best sense for some people who would want to correct these things and not just allow arthritic degeneration of the joint to the point where, it's all changed shapes in there and no longer causing actual noticeable pain. So it's up to the patient if they want to do preventive things or if they want to just wait it out or try other strategies like lots of pain meds at night or in the morning or whatever, antidepressants and counseling for your stress. That the idea that stress is the main cause of clenching and grinding is still the mainstream concept, but I think that has been kind of, there are other ideas that for me make more sense for a lot of cases. I'm not saying that's never the case, but that's not always the case. All right. You are listening to Dental MD. I am Dr. Jessica Sapoff, and if you have questions about any of the things that I'm talking about today, or you want to come in for an exam, treatment, second opinion, anything, give us a call, 425-427-8899, and you can also reach the front desk, appointments@naturaldentist.com. You are listening to Dental MD. I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
It's a great time of year to be outdoors, fishing in a local stream, splashing through a creek. We all assume these waters are safe and clean, but for most streams, no one knows for sure. That's a problem we can do something about. The Isaac Walton League of America can help us get started, from stream cleanups with friends to simple water quality tests designed for volunteers like you and me. The League has been helping community volunteers find and fix water quality problems for almost 50 years with simple tools that produce results you can use to test streams for pollution, to get your friends and neighbors involved, and to help protect streams where we enjoy the outdoors. To get started, visit iwla.org today. That's iwla.org.
Be sure to support the sponsors of your favorite shows on Alternative Talk 1150.
back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today's show is called Give Teeth a Chance because I think people get rushed into treatment. I think we're not, as a profession in dentistry overall, not giving the nerve inside the tooth, the pulp, enough of a chance to heal. And we've got our little guidelines, if the tooth does this and if it hurts this much and if it hurts when you do this and if it, hurts for this long and if it wakes you up at night, all that kind of stuff, so we can determine whether that nerve is past the point of no return. Is it over the fence? Has it given up? Is it dying to the point where it cannot recover, becoming necrotic? And if that's the case, then you're faced with, if the tooth still has enough structure to restore, then you're faced with a choice of getting a root canal or having the tooth removed. If there isn't enough structure or the tooth is cracked, then you don't have a choice. The tooth has to be removed. And if you think you can just walk around, if it doesn't hurt and it's self-draining, or you've taken antibiotics, or you've smeared some green goo around it and it doesn't hurt anymore. Pardon me for making fun of people who throw herbal stuff on their teeth. A lot of those things work in circumstances where they work, and it's great, and that's fine. But don't think that rubbing stuff on a tooth that is dead will make it okay to leave it there. In dentistry, we do not use the G word very much or at all, but in any other part of your body, if you have soft tissue, which the pulp of the tooth is, that has become necrotic, it is called gangrene, and it's like a medical emergency. You have to get rid of that. You do not want to walk around with dead, necrotic tissue in your body anywhere. But for some reason, people think that a tooth that has died, as long as it's not hurting anymore, if it still looks all right and seems okay, well, they'll just walk around with that. And I just don't think that's such a good idea, really. I just don't. And the thing about root canal treatments, the reason why a lot of people will choose, holistic people will choose to extract a tooth rather than get a root canal, that seems absolutely unconscionable and barbaric to somebody who thinks that root canals are just fine. And the majority of the profession and the majority of the public feel that root canals are just fine and no problem. And if it looks okay on the x-ray and it doesn't hurt, it's fine. It's okay. It's good. You've saved the tooth, they say. Well, it is impossible with our current state of technology to get every bit of dead pulp tissue out of that tooth. And it is impossible to sterilize the tooth. Now, in the case, there are some exceptions. In the case of a tooth that dies from trauma rather than from a deep cavity that infected the nerve and caused it to die because of infection, if the tooth died because of trauma, then it is sterile. It is not infected. There are not bacteria and other microbes and life living in the microscopic tubules of the tooth, which, if that is the case and a root canal is done, they can't get at those tubules. None of the devices or medicaments, medicines, chemicals that they put in the tooth can get into the little tiny microscopic tubules. The molecules are too big. That's what we've been told. And they can't get in, and they can't sterilize the entire body of the tooth. They can just clean and disinfect the main canals, shape them, and fill them with an inert material that, once you read the ingredients, you may not agree with using that word for it, but that's what it's considered to be. And is it okay to leave an infected tooth, because that's technically what it is. I talked to an endodontist once years ago, and I said, what about the dark area on the x-ray underneath at the root tip on a tooth that's had a root canal, that's got no symptoms and doesn't hurt, and that's the only defect, is that you can see this like little dark semicircle around the bottom of the root tip. Isn't that an infection? Shouldn't something be done about that? And the endodontist said to me, well, technically yes, but if it doesn't hurt and it's been like that for a long time and seems stable, what we like to do, he said to me, is instead of calling it an infection, which upsets the patient, we just call it an inflammation. We just tell them that's an inflammation at the bottom of the root tip, so it's okay. It's just kind of a chronic situation that's not getting worse, and it's stable, and just to leave it alone. Well, if that tooth is in your head, in your mouth, in your jawbone, you are the one that has a choice about what to do about that. The problem is that dentists overall will talk about things in ways that lead you to make the choices that they would make or that they think you should make. So the point is, and the reason I have this show, is to talk about things in ways that help you be curious enough to ask more questions and to help you know what questions to ask. And some of those questions are going to annoy some dentists. Have you ever asked questions, too many questions, and felt that little sort of feeling you get when somebody thinks you're annoying or asking too many questions? Well, you're probably going to find that. And if your dentist that you're talking to, sometimes it's because it's annoying and you're asking too many questions. But other times, remember, time is money. They're trying to be efficient. They're trying to earn money in their practice. When they're sitting there answering all these questions, they're not producing anything. They're not making tooth dust. They're not doing anything billable. And that's inefficient. And it's basically them giving away their time, which is usually quite overbooked in most practices, and they need to move on and do something productive in their mind in another room. So that's one of the things you're going to run into in a kind of a typical dental office. That's another reason why I have my fees set the way that I do, because I have time in my appointments for all those questions. And I want to make sure you get your questions answered. And I really have a hard time starting a dental treatment for a patient if I feel like that patient has more questions, or if I feel like they really need to ask more questions or get more information because they are making a choice based on incomplete information. And I really don't want to do a treatment in a case like that until they are absolutely sure and absolutely know and have investigated what their other choices are. So I will sometimes put off doing a treatment in order to give them a referral and have them go see a specialist about, if there is a specialty in the area, not the geographic area, but in that dental area that we're discussing in that appointment. Depends what it is, root canal or orthodontics or anything. So I will, in some cases, have somebody go get a second opinion or go do some more research before I will do a procedure. Even if that patient initially was willing to do a procedure, I don't want anybody to have regrets. And that's just the way I run things, because I like sleeping well at night, and that's what I need to do in order to be able to sleep well at night. So I began to talk about one of the exceptions to these ideas about root canals. Well, if a tooth dies because of trauma, like it got bumped and then the nerve was traumatized and became necrotic, it's still kind of iffy about those, but because, once it's dead, how long does it really take for it to become colonized? there's not a whole lot of research money for questions like that, unfortunately. So one of the things that we can do is periodically expose the tooth to ozone and oxygen, which does penetrate through gum and bone and tooth structure and kill microbes as it passes through. And incidentally, ozone can penetrate it's very small. It can penetrate the little tubules. We can actually further disinfect an old chronically infected root canal that's asymptomatic. The only problem is we don't really have research showing what the protocols should be, and we don't have any way to test the tooth and make sure it worked. We do know ozone will pass through these infected areas inside the tooth, and we know it kills bacteria. Is that good enough? Well, if you have a root canal and you don't want it extracted and you just want to do whatever you can to further disinfect the thing, then fine, that's what should be done. And incidentally, that as that ozone passes through the gum tissue and bone and into the tooth, it is killing bacteria in any gum pockets that you may have as well. Periodontal pockets, infected gums, respond very well to ozone treatment. All right, you're listening to Dental MD. We're coming up on a break. I'm Dr. Jessica Sapoff. If you have questions about today's show called Give Teeth a Chance, or any other questions about any dental topics and you'd like to get some answers and get a second opinion, give our office a call, 425-427-8899, and you can reach the front desk, appointments at naturaldentist.com. Email your questions. I'll be right back after this break.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Politics are not the only thing heating up in Washington, D.C. The climate is too.
By the end of the century, climate models show that if humans continue to burn fossil fuels at the same rate as today, that summers in the D.C. area will feel more like the climate at the border of Mexico near the southern tip of Texas.
That's Virginia Burkett, Associate Director for Climate and Land Use Change at the U.S. Geological Survey. She says the warming is already noticeable.
An analysis of temperature for the broad D.C. region shows that the year 2016 had the second warmest autumn on record since World War II.
The warmer temperatures are not just uncomfortable. A study from Columbia University found that before the end of the century, heat-related deaths in Washington, D.C. could nearly double to more than 200 a year. Burkett is particularly worried about the effects of extreme heat on the elderly, the very young, those with medical conditions, and low-income people who cannot afford to just turn off the air conditioning. But with the average summer highs reaching the mid-90s in the next several decades, everyone inside the Beltway will feel the heat. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
An alternative to everything else on your radio dial. Alternative Talk 11.
Dental MD. I'm Dr. Jessica Sapoff, and I am a holistic, natural, biological, integrative dentist. There are lots of different words for it. I practice dentistry according to the principles of natural medicine. That means The least invasive and least toxic methods and materials known are used at my office, and that's all that's used. For people who are chemically sensitive or have multiple allergies or don't want to become chemically sensitive or develop multiple allergies, then you might want to consider an office like mine or my office itself as a place to get a second opinion about materials and methods and choices. It doesn't necessarily mean you're going to go ahead and get a treatment, but you might once you know what the rest of your choices are. And practicing according to natural medicine, it doesn't mean that I'm practicing medicine. I'm not curing things in the rest of your body as an intention, but what we're doing is recognizing that everything that goes on in your mouth, everything that happens to your mouth, affects the rest of your body, and also everything that happens in the rest of your body affects your mouth. A lot of times people get the idea that only goes in one direction, and that the things that are done in the mouth, materials and techniques, are to blame for other problems elsewhere in the body. And I'm not saying that is never true. That is likely true in many cases. However, there are also, I'm certain, cases where problems in the rest of the body that are on meridians that pass through your mouth and pass through your teeth, those problems elsewhere in your body can show up in your mouth. Sometimes the mouth is the first place we see clues about what may be happening in the rest of your body. But I'm a dentist, and I'm only going to treat head and neck related issues and oral diseases of the teeth and gums and oral tissues, and TMJ, which is directly related to mastication, chewing of food, etc. And I will refer people to get the other parts of their body that are not within my scope of practice checked. And a lot of other practitioners don't necessarily understand that what they're looking at may be connected to something that happened in the mouth or maybe affecting something in the mouth. And it's nice if we all understand what those connections are, but the important thing is to get the problems dealt with and healed. Allow, not that someone's going to heal it, but that things are done that allow your body to heal so you can get on with what you came to this planet to do. Now, natural medicine and natural dentistry are aimed at allowing your body to do as much of its own healing as possible, nudging your body to do healing when possible rather than jumping in and doing an intervention to your teeth or gums that results in a permanent change to your teeth or gums without first giving your body a chance to heal the problem with natural methods that are less invasive or non-invasive and non-toxic, or less toxic at least. So that is the goal of practicing the way that I do, and that is what underlies everything that I do, everything that I suggest, and everything in the manner that I do things. So decay, let's talk about this in terms of tooth decay. Tooth decay is a rotted portion of what should be hard tooth structure. Now, whether that's completely caused by local factors or your diet, or if it's systemic. I mean, when most dentists say, things about your diet can cause decay, they're talking about stuff that touches the teeth. But it's another possibility is that there's a systemic component. For instance, your saliva is supposed to be remineralizing your surfaces of your teeth 24/7. But is your saliva governed by local factors? a little bit and transiently, just for the few moments that you have whatever you have in your mouth. Your saliva consistency or pH obviously changes. The amount of saliva changes. But primarily your saliva is a systemic controlled issue. So what's happening in your body systemically, even psychologically, will affect the quality and quantity of your saliva, which in turn affects whether your teeth are able to remineralize maximally. So saliva has to be optimal, and that means if you're under stress or you have adrenal fatigue or you have, sleep apnea, which causes high levels of stress over and over again all night long, and you are on caffeine and other things during the day to stay awake, your saliva quality is going to suffer. The amount of saliva is going to suffer. A lot of medications cause dry mouth, which is less saliva. Stress, it's just like you're about to walk on stage. And for some people, they're stressed to some degree most of the time. I mean, this is a very stressful time to be on the planet, let's face it. But whatever you can do to try to overrule that by deep breathing and meditation and yoga and other things that bring about more joy and bliss and feelings of love and gratitude, it's lovely, right? I mean, that's nice. We all want that in our day. But the effect on your health, the field that you generate by having those feelings predominate, not just for 20 minutes a day, but predominate your life, that's when the field created by those emotions and that state of being, I believe that's how we can maximize our ability to heal and overcome the things on the planet and in our lives that work to the opposite effect, like cause us stress or cause us exposure to toxins and whatever that makes it hard to heal or interferes with healing or stops healing or destroys our health, if in the case of very toxic chemicals, for instance, or radiation. So this is important, and this is part of thinking about health in a holistic manner. Now, in my office, because I'm a dentist, I have all of these beliefs and intentions underlying everything that I do. And everything I do is focused on dental issues, procedures that promote your own body's ability to heal, that are within my scope of practice, which is dentistry. So I do limit what my procedures are. Now, I believe that ozone treatments and oil pulling, which is gently rolling natural oils of your choice around your mouth for 18 to 20 minutes, and other kinds of, supplements that you might take to help with dental healing that have vitamin K2 and prevent decay, like cod liver oil and things like that, butter oil, that while we recommend those things on the basis of their impact on your oral health, these things also can impact your overall health. And I just want to point out that the oil pulling, for instance, people ask, why do we have to do that for 20 minutes? And it turns out this is an ancient Ayurvedic technique. And anything that's around your teeth and gums that's lipid soluble, that dissolves in oils and fats, will come into the oil in your mouth and get stuck there. You're going to spit this oil out when you're done swishing it. And you don't have to swish vigorously, just gently. But why 20 minutes? Well, it turns out that it takes 18 minutes, I believe it is, for your entire bloodstream to make one circuit around your body. So in 20 minutes, all of your blood will have passed through the vessels in the tissues of your mouth. So now, is it a dental and gum health procedure, or is it a full blood detox? Well, the Ayurvedic instructions were, I believe, 18 minutes or whatever the equivalent time delineation was at the time. And if you do this for 18 to 20 minutes, I believe that toxins will come not only off of your teeth and out of your gums, but may also pass through the reason your inside of your mouth is pink is because the tissue is very thin and there are a lot of blood vessels in the surface of the tissues of your mouth. Well, there are a lot of reasons for that, but the advantage that we're discussing right now is that it's possible that toxins that are in the blood may get pulled through the vessel wall and through the wall of the oral mucosa into the oil and be trapped there. So it is maybe theoretically possible that this is detoxing your bloodstream, which would be a wonderful thing. But when I, as a dentist, recommend oil pulling, I'm going to let you know about that. But the reason I would have somebody do oil pulling, that I, as a dentist, would recommend it, is to help with the health of your teeth and gums. And so I do recommend that people do this. It's not harmful. There's no limit to how often you can do it. I've had people say that they feel that their breath is better. The tonsils, I've had reports that tonsils improve. Sometimes mouth odor isn't from the teeth and gums. Sometimes it's from your lungs. Sometimes it's from your stomach. Sometimes it's from your tonsils and your throat. So there are, a lot of different ways to approach helping people with odors that they're worried about in their breath. And oil pulling is one of the ways that people have reported that things improve. So we are coming up on a break. When we return, I'm going to talk more about how I prevent trauma to teeth as part of my natural medicine approach to allowing your body to do as much healing as it can do. And part of that is by not causing any more trauma during a procedure than necessary. And that can vary depending on who you go to. So you're listening to Dental MD. I'm Dr. Jessica Sapoff. And if you have questions about any of the topics we're talking about, give the office a call, 425-427-8899, or reach us by email, appointments@naturaldentist.com. I'll be right back.
I was feeling so alone.
I was going through a really difficult time.
I was embarrassed and a little scared.
I didn't want to bother anyone.
I didn't think they'd understand.
I thought it would just make things worse.
It was tough at first, but I did it.
It ended up taking a huge weight off my shoulders.
I feel a lot better.
I'm glad I asked for help.
I asked for help.
I asked for help.
I asked my teacher. I asked my aunt.
I asked my dad.
I asked my mom.
I asked the Trevor Project.
Now, I feel like I can get through this.
I know that I am brave.
You can do this.
You can do this.
You can do this.
Ask for help.
Ask for help.
Ask for help.
Ask for help.
Whatever it is, ask for help.
If you're thinking about suicide or need support, call the Trevor Lifeline at 1-866-488-7386. Trained counselors are there to help 24/7. Ask for help.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Seattle, Tacoma, Antwerp. That's right. We're streamed worldwide on our app and on the web at 1150kknw.com.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. During the last segment, I was talking a little bit about decay itself. I'm going to go back into that, and I'm going to talk about how I do treatment in a way that is as atraumatic, preventing trauma to the tooth and the nerve and the gums and everything around the tooth and the jaw and the person who owns those things. So it is important not to traumatize teeth. Today's show is called Give Teeth a Chance, and we want to maximize the ability of the nerve or the pulp inside the tooth to heal, and minimizing trauma during procedures is one of the ways to assist in that process. Sometimes, in the interest of staying on schedule and doing things quickly and being as efficient as possible, and in most offices, it's very primary for them to stay on time and do, and that is important. So, but they also want to have the appointments be as short as possible so they can see as many people as possible, and they double book and they whatever, and they've got everything very efficient, and they do everything the same way every time. The assistant knows exactly what to hand the dentist. Everything's very clockwork, and that's all fine, except that my primary goal when I'm doing a procedure is to not traumatize the tooth. Sometimes that means I go slower. So I know this, so I have longer appointments. That's one of the reasons the fees are what they are, but this is the reason, and I'm going to explain it. So decay itself is rotted tooth area. There are no nerves there. There's no feeling there. The mush, doesn't have any pain fibers. It can't feel anything. So what is the feeling that people have in a tooth? Well, if the tooth is already upset because the nerve is already inflamed, because the decay has gotten so close to the nerve, now anything you do that touches or bothers the tooth is going to potentially bother the tooth, like the cold water or the suction, which feels cold. Everything cold registers in the brain as pain for a tooth. That's the message it sends. It only knows 0 and 1, on or off, pain or no pain. And a little cold water, it doesn't say, oh, that's cold. It says pain, ouch, that hurts, don't do that. So a tooth that's in that stage, I think anesthetic is warranted. It's called for, getting the tooth numb so that you can work on it. But for a tooth that doesn't feel anything when you're blowing air on it, suctioning, water spray, if the tooth is okay and not having any symptoms when you do that, then what I generally will do is I'll offer the patient a choice. Would you rather be numb for this? And I'll let them know whether I think they're going to feel it or not after kind of checking the tooth. And some people do. They want to be numb. They don't want to feel anything, no vibrations, no water, no chance of any possible discomfort. Okay, fine. Other people are like, no, if it starts to bother me, I'll let you know, and, then we'll numb it if it starts to bother them. Okay, so if that's the case, then I'll go ahead and begin gently unroofing the area where the decay is. So the tooth structure over the decay that's hiding the decay underneath, that also has no feeling. There's nothing alive directly under it. It's just a shell. So that can just be removed. It doesn't hurt. So I remove that, unroof the decay, gently, slowly abrade out the decay, removing soft, mushy tooth structure with little tiny spoon or a burr that's designed to just kind of gently remove and abrade. I'm not really drilling at this point. I'm just abrading away anything soft. I'm going so slowly that when I actually touch some tooth structure that's more solid, it actually stops the burr. That's how slow I'm going. So anything that's hard, I can tell the difference. I can feel it with how the burr moves. And I can also feel it when I use my little tiny spoon. And I will remove decay all the way down to where I'm at solid tooth structure. Now, that tooth structure may have staining because of the decay that was right next to it or food that had gotten in there. This is where there's a little difference of opinion. Is this decay or is it just stained dentin? Most dentists, and we're trained to do it, drill it away. Well, 1 minute later, you could be in the pulp. You could be in the nerve. The tooth could be bleeding from the inside because you removed the next layer because it was stained, which we're taught in school. If it's stained, it's decay, and that's not really the case because I studied karyology, and there's a layer of demineralized tooth structure that is not infected and does not need to be removed and can remineralize. And the nerve underneath will remineralize it from below. If you leave that and you allow the nerve to remineralize from below and you put a remineralizing base layer directly over that area, which will be under the new filling, you basically sandwich that demineralized layer between two things that will remineralize it from above and from below. Well, then you put the filling in, and then you hope for the best, and you hope that nerve remineralizes that area and heals. Now, this is in a tooth that hasn't had any symptoms yet, but has very, very, very deep decay. A lot of dentists will recommend a root canal instead of doing this kind of a procedure. Or they may do it and also send you to the endodontist or start a root canal. Or if they think they're real near the nerve, they will tell you, you know what, we're so close to the nerve, this tooth's going to need a root canal. Let's just go ahead and do a root canal right now. We'll just start that now, put a temporary, and you come back, we'll finish it and do a crown. That is how it usually goes. And you're lying there and you may or may, well, in most offices you're numb, so you don't know anything, and they tell you that they're at the nerve now, and this tooth is going to need, the decay was so deep it was into the nerve. And what are you going to say? You're lying there with a dam on, and you just say, oh, that's a bummer. Okay, well, go ahead. What else are you going to do? So that's the reason I call this show Give Teeth a Chance, because my goal is to do the decay removal in a way that I want to say to you, we got decay out. There was a demineralized layer. I put remineralizing medicine in there, and then the filling. This tooth could still abscess. The nerve could still die. The procedure, as atraumatic as I try to be, is still a procedure. The nerve may not like that. We were in there. We were drilling. We were removing decay. That could be enough to, kick it over the edge if it's real close. But let's give it a chance. Let's see if it remineralizes. Let me know if you have any symptoms. Then we'll move to the next more invasive thing that becomes necessary if that's the case. But let's give this tooth a chance. Let's give the pulp a chance to heal. Let's see if it remineralizes. Let me know if you have any symptoms. That's what I mean by give teeth a chance. That's how in my practice, how I treat decay in a way that, but I have a lot of experience with this. I know which teeth are likely to recover and which ones probably won't. But, we sit and we discuss what the chances are. So I wanted to talk about that because trauma to the teeth during a procedure, and by the way, when somebody is numb, it's a lot easier to go fast and cause more trauma just because the person can't feel it and you can get in there and do things real fast. I prefer when patients don't need to be numb or don't want to be numb so that I can be very, very light touch and not traumatize the tooth, because it's just, I like the patient to be able to let me know if something's uncomfortable. You have been listening to another hour of Dental MD. I'm Dr. Jessica Sapoff, and this is a weekly show. There are archives. You can go to 1150kknw.com, Dental MD radio show archives, and check out topics that you may have missed or are interested in. And you can give the office call if you want to ask questions or get an appointment, 425-427-8899. And you can reach us by email, appointments@naturaldentist.com. Thanks for listening. I'll be back next week.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KKNW, its management, or other